Hi, this is Dr. D. I am a GP in the UK, and on my YouTube channel I talk about common symptoms and conditions that we see in general practice. This video is not for doctors, but for patients, where I explain the symptoms and provide advice about what to do about them. If you want to receive updates about the new videos on my channel, please click subscribe and notifications buttons. Today we will talk about COVID-19. I guess there is not a single person on this planet who hasn't been affected by COVID in this or other way. By now in certain countries like the USA, even more people have died of COVID than in both world wars combined. COVID-19 is by far not the first worldwide epidemic that affects humanity. Since the Black Death, there were always predictions about massive pandemics coming back again and decimating the humankind. The last and best known example is 1918 pandemic of H1N1 virus, or the Spanish flu. 50 million people have died of it worldwide, which is 2.5 times more than all fatalities caused by World War I. Since then, however, we never had catastrophes of such scale. Coronavirus or COVID-19 is a novel virus that emerged in Wuhan, China in late 2019. Genetic analysis suggests that bats may be the original host of this virus. On 11th of March 2020, the World Health Organization advised that the situation was now a pandemic. The commonest symptoms of COVID are fever, cough, and shortness of breath. Other common symptoms include headache, loss of smell and taste, nasal congestion, muscle pain, sore throat, and diarrhea. The illness is variable in severity from completely asymptomatic, many people find out that they had it only from a positive test, to severe pneumonia in others. Mortality rates are thought to be 2 to 3% depending on age and pre-existing morbidity or vulnerability due to immunosuppression. If you think you have COVID, you need to self-isolate and arrange for a swab test by booking it online, or if this is not possible, call 119 in England, Wales or Northern Ireland, or 0300 303 2713 in Scotland. People who are unable to self-care, have severe symptoms, or are immunosuppressed should contact 111 online. People with suspected coronavirus are being advised not to attend their GP practice to avoid spreading it to other patients. The criteria for hospital admission include evidence of pneumonia or acute respiratory distress syndrome or flu-like illness with a fever and a significant shortness of breath. Isolation advice: if people have symptoms of coronavirus, they need to stay at home and self-isolate for 10 days after symptoms started. People can stop self-isolating after 10 days, if they do not have any symptoms. Please note that a cough, or changes to sense of smell or taste can last for weeks after the infection, so no isolation is required for longer than 10 days if you still have these symptoms. You should still self-isolate after 10 days if you have high temperature, a runny nose or sneezing, nausea or vomiting or diarrhea. If you live with someone who has symptoms or has tested positive, the advice is to self-isolate for 14 days. This is because it can take 14 days for symptoms to appear. The 14 days start from when the first person in the home started to have symptoms or the day they were tested if they have not had symptoms. If you develop symptoms while self-isolating, you should book a test and keep self-isolating for the remainder of the 14 days. There are vulnerable groups who are at higher risk of COVID. For a full list, please see the website in description. There is no specific curative treatment for coronavirus infection at present. Management in both primary and secondary care is mostly supportive. Some people have persisting symptoms after having COVID-19 that may last 4 to 12 weeks. There is now recognized post-COVID-19 syndrome that may last longer than 12 weeks. If your symptoms have not resolved 12 weeks after having COVID, please speak to your GP. COVID and associated lockdowns have affected our life significantly. In my practice, I see significant worsening of mental health as a result of social isolation and withdrawal of usual support measures in the community. If your mental health has been affected by lockdown, see my video about depression. I hope you have found this short video useful. In the description there are links to the NHS and gov.uk websites where you can read more and make self-assessment. If you liked this video and would like me to make more videos, please support me on Patreon, the link is here and in the description. If you want to see a video about my favorite COVID memes, please click on this link. If you would like me to speak about more medical conditions, please leave your suggestions in the comments.